I have a question that's really off the charts, that when, as a scientist, at what level do you, and I don't even know how to phrase this so it makes sense, but the miracle of life and sort of reviewing genes and just how the whole process of life functions, as a scientist, you can sort of put that under miracle work in a weird way, right? No, not at all? I'm not saying this from a religious...
Sweat.
I'm not saying this
It's
from a
a lot of
religious...
sweat, I think.
But just the cells dividing and just how things become what they... Have you experienced or witnessed some form of miracle from a scientific vision? Does it become not science anymore and something that falls into miracle land? Does that even make any sense?
I'm sure maybe it's just beyond, the way I think about it, but listen, I think every time, listen, I don't want to sound silly or trite in this, but...
You're next to me,
No.
you're fine.
Listen, I think every time, listen, when I go to the OR with Peter, and you see what the surgeons do, just to have that kind of, I started as a pediatrician and trained as a geneticist, and now I'm a researcher. To go into the OR and see what these guys do, the responsibility they take, what they do, what it can mean to a life, yeah, that's a miracle. I think when you meet some of these patients, who maybe have very good goes, maybe don't have very good goes, and you kind of talk to them, and then all of a sudden, that wall of, a cancer patient a little bit distant, it's like, wait a second, this is a friend, this is someone I know, this is, and how they approach life and still cherish it, that's a miracle. When we kind of look at all the things that we do in the laboratory and we think about the genes, how the cells grow, how they respond, I don't know if I would call it a miracle
in a religious
sense.
Right.
No, and I don't
But,
approach things like that so much. All I'm thinking about is, gee, I wish I paid attention more in biology, because I mean the whole
gone.
thing, ship is sailed.
Too far gone.
But just the whole science piece is miraculous. I mean, I think there's still people that look at, birthing babies and sort of like,
And that's a
whoa,
miracle.
yeah, really,
That is a miracle.
but it's not any different than what you see in a lab of cell.
It is truly amazing when you think about what everything that has to go right.
Right,
And
that's
the number
what
of
I'm
things that
saying.
can go wrong. It is
And how much
amazing.
is against you as you do this? I mean,
Why
did
were-
this
why
cell
were they
take
here
and
talking to
culture
us?
And sometimes I just wonder, I'm not bringing in divine intervention so much as the miracle of life itself, of a will to survive, or any of those pieces that play into gene study. I mean, because there are literally people who are like, oof, check, 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 not looking good. And they're like,
walking around and
it's skipping to the seashore. And why that? And then this one who had one little stray hair. I just wonder, how does that play in? Never mind, you talked about being in an operating room. I wonder if someday, looking at the treatments of ovarian cancer and how the traditional hysterectomy and the sort of the staging process and all that, is that going to be a thing of the past? Like where you're actually gutting someone like a fish and yanking things out?
You don't gut people like fish.
Well, there's some gutting
yank
going
things
on.
out.
In a nice way.
It's
but
very elegant.
yes, it's elegant. It is. It is
is.
elegantly done.
Yeah.
True.
Yeah.
In some cases.
Yes.
I've heard
No,
some
we won't-
doctors
we won't talk
initial.
about that. We won't talk about that. If I took three patients and we're treating them, we may have one patient who gets one round of chemotherapy and then they're good for life. We may have a second patient who responds initially, but it'll come back, and so we treat them 4 or 5 times, and they'll still live many, many years. And then we have those patients you treat and they just don't do well. And all 3 groups started off with exactly the same treatment. So what's the difference? Something about
The
the
type of
biology.
cancer?
They're
The type-
all ovary cancer. Histologically, they're all the same cancers, but there must be something in the biology of these tumors that are different in patient A versus patient B versus patient C. And I think, John, you're looking into something like that. So tell us a little
And
bit about
indeed,
that.
I mean, spot on in the sense that, I think that just encapsulates everything. And I think there are probably 2 points I think we should make from there. One, when you look at these tumors, as you were saying, they are exactly the same. They can be exactly the same from 3 different women, 5 different women. They can be treated by the same surgeon, by the same oncologist, similar age, similar presentation, and yet have wildly different outcomes. And part of that is what can be seen in a microscope can be very different from what's going on genetically in the tumor and also in the rest of the body, which may come back to your initial point about what one does outside, environment, health, general things. Nutrition, exactly.
Mental,
how one approaches it,
absolutely, yes.
So all those things come into play. But what we're learning now is if you actually kind of dig deep into the genes, you'll see that different genes may have been mutated. So it's kind of like you've arrived at the end point, right? You've arrived at a particular location in the city.
Right.
How you got there may be very different.
Right.
You may have cut across on the FDR Drive, you may have come down Fifth Avenue.
We're back on Fifth Avenue.
It was harrowing. And, but that, how you got there
Right.
may make a difference. The other thing that I would say, probably this is something that evolved over the past 10, 20 years, is philosophically one would always like to say, I'm cured, I'm clean, I have no evidence of disease. But I think, and I've learned this working with you guys, is that it's really a paradigm shift in how we think about cancer. In the sense now where
It's a
you
chronic
can
disease.
It's a chronic
disease, right.
Exactly.
And I think that's something that we try to impart to the patients. Just like a diabetic may have to take insulin for life, some people have to stay on chemo. And it may be a touch here and there, it may be for once a month, it may be every 3 weeks, it may be every week, but you may have to, come back to that treatment at some point in time. And I think if you enter this process knowing that that's a possibility, it may make it, and I'm just speaking from, not from a personal experience, but I think it may make it a little bit easier to deal with. Because I can only imagine, and you can speak to this, that the rise and falls that you go through when, I'm cured, and then this comes back again. It really, you have to start changing your mindset about this disease, particularly this disease, compared to some of the other diseases where one time that's it.
And indeed, so there's things that we can bring to bear, in the research sphere, the armamentarium that Anne-Marie can bring. But again, I think it comes back to your point of the patient and the individual. What will they bring? What strengths will they bring to bear to think about? Now they've got to, bring everything else, all their strengths to bear, families, themselves, spirituality, to really go through a whole new process.
Well, I was talking to Dr. Totino and saying, well, I've seen stage 4 ovarian patients that get a treatment and go on there and don't come back.
Sure, that has happened,
And then the
absolutely.
early stage people that you would think, and
Right,
then
they come back in 6 months or a year.
so when you say it's a chronic disease, on the one hand, for people who used to get a death sentence, that's like, I can
I'll
deal
take
with
that.
diabetes.
I'll
And
take
then
that.
on the other hand, it's sort of like, I wanna look at it as it's out of my life. And at what point you have a doctor who comes to the table and does brilliant surgery, does unbelievable research, knows this back and forward, knows the cocktails of drugs that will work out of experience of so many patients, this will work this way. And then where does the patient actually have to come to the table and contribute to their well-being? And, because at some point, does that factor in, or it is genes?
Absolutely, listen, I say that every time someone walks in here,
You have said this.
I can look at their whole mental outlook and I say, we're gonna have a problem. Not a problem with the patient, a problem in terms of longevity. Because I think that there is so much that the mind brings to this. If you come in this with a very negative sense, always worrying about things, it makes it harder. And I don't know, there's no science to connect the two, but just clinically, I can tell. I walk into the room and I meet a patient for the first time and I'm like, this is gonna be really tough. And half of my time is spent treating them with drugs, but half of the time is spent trying to clear the head, trying to get them in the right mindset to approach this disease.
That's the part I think I was trying to ask earlier is, can your mind alter DNA or genetic, can cellular structure, from a science standpoint, can you willfully do something?
As a geneticist, as a non-geneticist, I'd say no, but what would you say?
You know, it's a hard question. I don't think anything maybe in a traditional way that we would think, if you think hard enough about it, you can maybe cure it or change that gene back or change the outcome. And again, I say that because I don't want someone out there thinking that if it didn't change,
Sure.
they approached it the wrong way.
No, I understand.
But beyond that, and I think the journey, you know, once you get a diagnosis, the journey is so difficult. I think clearly how you approach it makes all the difference.
You know, we don't know what, exactly what hormones or what levels of critical things in our body get altered by severe stress, by severe, you know, patients go through all of these things, and we don't know how much that affects it. We haven't looked at that. So some of that may be pertinent to how a patient really does in the long run. You know, I'm not saying that that's the main factor by any means. Of course, you know, the biology of the tumor, the stage of the disease, the histology of there's so many factors that go into why one patient survives longer than another patient. And I guess that's what makes your job so difficult, because it's a complex thing. It's not, you know,
Yeah.
A and 1 and 2 would
Right.
be 3. It's just a very, very complex thing.
But it's interesting how you always take this wonderfully empathetic view of being a patient, and I've met other patients where they definitely don't want to take that responsibility of, I did the best I could, do I get the blame for this too? And it really is a blameless thing.
Right.
And then I think that I'm just, from a personal standpoint, I like the idea of, I can change it.
Right.
You know, like, I like to
And
participate.
to some extent, maybe you can, of course. To
But,
some
you know, I
extent.
guess it's, you know, it's as different as genes are different. I guess, you know, the mental state and.
You know, again, you can make a difference, there is no doubt. And I'm not saying that, you know, just to change a position, but again, you know, I think as we think about the genetics, that's just one piece of it.
Mhm.
That may have gotten you to your destination.
Right.
But, you know, where you go to the next point, you know, clearly stress plays a huge role in how you'll maybe combat it, you know,
Mhm.
how you'll succumb to it.
Well, I'm just fascinated by that whole piece of reoccurrence and why here but not here. And, you know, certainly with women, all you can hope is that you get there in a timely manner. Hopefully all your research will be able to detect things in an earlier stage, and then once you go through the whole process, that it doesn't come back. So there's so many stages of having to treat cancer.
I mean, that's what we all hope for, right? Yeah, absolutely.
We want to thank you for joining us here at SuiteTalk, and come back and visit regularly, where we're going to bring in all sorts of interesting people. We're going to go to John's lab and see what sort of mice he's got running around there. We will take Fifth Avenue up there and see. We just hope to bring lots of topics to you and try and discuss things and talk about things, and we want to hear from you. You can go reach us on SuiteTalk at lovelifeskincare.com, and we want to hear all of your input on people that you want to see or topics you want to discuss, and we really want to talk about survivorship and all topics related to cancer. So, thank you.
Thank you, John.
Thank you both.